Welcome to Medical Marijuana and Wellness. Tonight's topic is neuropathy relief with medical marijuana. And I have to tell you, neuropathy is something that, and the people that I've worked with, the people I've talked to, very painful. And something that, again, people suffering from neuropathy, and of course, the caregivers are looking to help not only with the pain, but also to give some relief so that people can lead as close to a normal life as possible. And again, neuropathy is not fun. We understand that. And pain is the main reason that people are, at least that's the main cause or the main issue that people are really looking at. So we're going to explore that today. We're going to talk a little bit about what neuropathy is, how medical cannabis can work, a little bit about the research, and then more importantly, some recommendations on what you should use to address neuropathy. Now, I do want to point out that prior to doing this webinar, I had a couple of housekeeping issues. First of all, one of the housekeeping issues is that this webinar is designed to be for information and also for educational purposes. If you have any issues related to a medical condition, please ask your doctor or your medical marijuana practitioner. They can help you get specific recommendations for your particular condition. The other thing I want to point out is that this webinar is being recorded. It'll be put on YouTube, and so you'll get an email after this video, and what you'll get is a link to the recording of the video on YouTube. Also, you'll get the deck in flipbook format, and then some slides. We're going to put various slides will be available to you to talk about various conditions and things we want to point out. So you'll be getting some information after this. What we're going to do is we're going to play a short video that's going to talk about neuropathy, what you can do about it, and some recommendations. Then we're going to jump into addressing your questions that were submitted prior to the webinar. And I should point out, during the webinar, we're here to answer your questions. So please hit that Q&A button at the bottom of your screen. If you have any questions during the webinar, we're here to answer them. And I know that a lot of people have questions and they're hesitant to ask. There's no such thing as a dumb or bad question. We're really here to help you not only address this issue, but also help you get your life back. So with that said, let's jump into the video, and then we'll jump right into the questions and answers right after that. Welcome to Medical Marijuana and Wellness. Today's topic is relief from neuropathy with medical cannabis. And I should point out that this particular video is being made for information purposes only. Naturally, if you need any medical advice, please contact your physician or medical marijuana doctor. Now, I should point out that we have some other videos that you may want to watch that support this topic. They can be found on youtube.com/@marijuanaaware. And they include Understanding Cannabis as Medicine, Smarter Cannabis Dosing for Reliable Relief, Your Terpene Toolbox, and Cannabis Medibles. And of course, don't forget to subscribe to the channel to get more information about medical cannabis. Now, what is neuropathy? Neuropathy occurs when the protective coating of the nerve cells, also called myelin sheath, starts to degrade. When that happens, it damages the peripheral nerves that cause pain and also numbness. Now, when the sheath of the nerve cell degenerates, the signals being transmitted by those cells are scrambled. The results are the signals received are misinterpreted as numbness, heat, cold, tingling, pain in the toes, feet, legs, fingers, hands, and arms. Now, the common types of neuropathy include peripheral neuropathy, which damages the nerves in the toes, fingers, hands, and feet. Proximal neuropathy leads to pain in the lower body, often on one side of the body, and weakness in the legs. Autonomic neuropathy harms involuntary processes in the body, such as digestion, and focal and cranial neuropathy leads to visual disturbances. Does cannabis help with neuropathy? Well, let's take a look at what the research and the studies are telling us. First of all, the Foundation for Peripheral Neuropathy ran clinical trials with different routes of administration. They looked at sublingual, oral, smoked, and vaporized, and that they demonstrated that cannabis had an analgesic benefit in the treatment of neuropathy. Also, they recommended that treatment guidelines for neuropathic pain should recommend the consideration of cannabinoids as a second and third agent. When we take a look at PubMed, we find an article from CMAG, which is a Cannabis Medical Association journal. And what this tells us is that cannabis has a moderate analgesic effect in patients with neuropathic pain, and that this is more pronounced in central neuropathic pain as opposed to peripheral neuropathic pain. The bottom line is cannabis is effective at helping to address neuropathic pain. Now, what researchers have found is that CBD has been shown to protect the myelin sheath that covers nerves. Specifically, it acts as a neuroprotective agent, which helps to normalize the glutamate homeostasis and also reduces the oxidative stress on the nerve itself. What this does is it inhibits the production of a couple of different proteins, the NF-κB and cytokines, which actually goes in and decreases the inflammation and the pain in your body. So how do we treat neuropathy with medical cannabis? Well, my suggestion is we take a look at the terpene profile of the products that you're going to be using. Specifically, if we look at the symptoms of neuropathy, specifically that it's an analgesic, neuroprotectant, and pain management, we find out that there are some recommended terpenes for those particular conditions. Specifically, they are D-limonene, beta-caryophyllene, A-pinene, eucalyptol, linalool, and A-bisabol. Now, there's also some terpenes that we may want to limit because they are what we call sleepy terpenes. They can provide you the capability to be relaxed, but also potentially fatigued. And these are linalool, germinal, beta-myrcene, boreal, and terpinolene. So what's the best way to take medical cannabis? Well, there are various routes of administration, but a good rule of thumb is that the fastest in is also the fastest out. And what we mean by that is if you take a look at the average onset time, if you have a quick onset time, you'll have a shorter duration time. Like, for example, with topicals, 1 to 10 minutes, you'll have a duration time between 1 to 2 hours. And that's the same for concentrates, vapes, and flower, 1 to 10 minutes onset with 1 to 4 hours of duration time. And the only product in this particular category that kind of defies this golden rule is that some of the transdermal patches are made that not only last 4 hours, but also last as long as 72 hours. Very good product to take a look at. And it's something that helps you get over that initial pain when you wake up in the morning or you have that particular uncomfortable feeling. Now, if you take a look at products like single tinctures and sprays, they typically take 15 to 20 minutes to work, but they'll work for 4 to 6 hours. So this will give you coverage in the mornings, in the afternoons, in the evenings by using these particular products. If you're looking at something that has a longer duration, for example, you want to take something prior to going to sleep, or something where you want to have a nice chill out evening, this is where your capsules and your edibles come into play. They have anywhere between a 20-minute and 2-hour onset time, but they'll last anywhere from 4 to 10 hours. And by the way, I do want to point out, if you're looking at these products, capsules and edibles, they take full effect in about an hour to 2 hours. So be cool. Don't take another one in 5 or 10 minutes if it's not working. Let that 1 or 2 hours go by because they will work. And what you don't want to do is take too much of the product and put yourself in an uncomfortable situation. Now, one of the questions that you may want to ask is what products should I look for when I go to a dispensary for neuropathy? And this is an example of the products that Air dispensaries have that they recommend for neuropathy. Specifically, they contain the terpenes that we're looking for, and you can see they all have a very generous terpene profile, which helps you identify what you want to use to be able to address your particular condition. And again, you have a wide variety of products to look for. This includes whole flower, live resin vapes, edibles, and distillate cartridges. So what's the bottom line? It's important to point out that there have been no fatal overdoses from the use of medical cannabis, either medically or recreationally. And this has been reported by a number of international organizations, including the World Health Organization. Cannabis also has no addictive properties, unlike opioids and tobacco. You don't need to smoke it to be able to get the full benefits of it. And used correctly, medical marijuana will not get you unexpectedly high or uncontrollably high. This is something that's very, very important and what differentiates medical cannabis from recreational cannabis. The bottom line is that with medical cannabis, many people have been able to get their life back. I think you can see from the slides that we just presented, there is an alternative for neuropathy using medical cannabis, especially following the terpene profiles that we were talking about. I know that in many cases, people are confused about what are terpenes, how do we use them? Well, the bottom line is we know that these terpenes have been tested for things like, for example, chronic pain, for inflammation, and we do know that CBD especially is a great product to help do the neuroprotecting coating that helps with the mylar sheath. So we know those products work. So when you go into your dispensary, talk to them about the terpene profile. More importantly, tell them that you have neuropathy and you want to take a look at using a product that is usually higher in CBD or has CBD and also THC in it. And those two products working together give you the entourage effect that will really help you with this particular condition. Cannabis is not going to cure neuropathy, much like arthritis. It'll help you be able to manage the condition. It'll help you basically live your life, but it's not going to get rid of it. It'll just help you cope with it and be able to get rid of the pain and be able to, or at least relieve a lot of the pain, get rid of much of the pain, and be able to live your life normally as possible. So that being said, let's jump into some of the questions that were asked prior to the webinar. Okay, first question is, what routes of administration are recommended for neuropathy, and what should any be avoided? Well, first of all, when you talk, I'm sorry, excuse me, that's the second question. My bad. Let me go to the first one. What are the best terpenes for neuropathic pain? Well, first of all, what are we looking for? We're looking for something that'll help with pain, inflammation. We want something that is an analgesic, and we want something that actually can hopefully work fairly quickly. So what we found when we look at our terpene table is that pinene, limonene, linalool, caryophyllene, and beta-caryophyllene and bisabol are really some of the most important terpenes to address neuropathy. Notice they also are all anti-inflammatory, and they also help quite a bit with pain. Now, I do want to point out that if you are using a product that has pinene in it and you have PTS, be a little bit careful because pinene does have the capability of bringing back short-term memory, and we really don't want to trigger any of those negative thoughts that really cause some of the problems that you have. But the rest of the terpenes, which are limonene, linalool, caryophyllene, and bisabol, will work very, very well. Now, what you also may want to do is you may want to also talk to your dispensary about the routes of administration because in many cases they'll have tinctures, they'll have gummies. They may even have some topicals that have these products in there so they can help quite a bit. And by the way, topicals work very, very well. We'll talk about that when we talk about routes of administration in just a moment. But these are the main terpenes that you want to focus in on. And again, a lot of testing has been done to make sure that these are the right types of terpenes. And again, talk to your dispensary. They'll help you find the products with this particular profile. Next question is which routes are recommended for neuropathy? Should any be avoided? And what we're talking about here are really the routes of administration. This is how you take cannabis. And I know that really there is no, one of the questions is, should any be avoided? And I think the answer is really no. Although I do know that when you have neuropathy, you may have problems, for example, opening bottles. So, it may be difficult to get the tincture bottle open. You may want to also, and also, I really don't think, in my particular case, I would try to avoid a lot of the dry flower products. In vaping products would work great, but just the process of being able to roll a joint, roll it up, put it up, light the joint, that type of thing. That's a process that can be difficult for some people who have neuropathy, or if they have a vape pen, that would help quite a bit. So really, what you really want to take a look at is something that you're comfortable with based on your neuropathic condition, what's comfortable for you. I recommend a couple of things. First of all, I recommend topicals. They work great. And I know that they start working within 1 to 10 minutes and they only last 1 to 2 hours, but they give you instantaneous relief, which is what a lot of people are looking for. And if you can find, and there are transdermal patches out there that will work not only go to work right away, they'll work 8 to 72 hours. They help quite a bit and they can help especially. And I recommend getting the patches that are 1-to-1 because the combination of CBD and THC really is what you're looking for. A patch that has THC only or a patch with CBD only won't work as effectively. CBD could help, but CBD with THC is over the top. It works much, much better than just CBD by itself. Concentrates might be a little difficult to use, but there are some concentrates that work very, very well. And the nice part about concentrates, especially if you get into rosin and resin, they work very, very well because they have the full complement of terpenes in them. And the other thing you might want to pay attention to is a product called RSO, Rick Simpson oil, or FSO, which is a full spectrum oil. These also have a full complement of terpenes and they can help you quite a bit. And I hope that helps quite a bit. I hope that helps answer this question. There's a couple other related questions. I've tried an indica vape and indica capsules and THC cream, but nothing has worked for me. What should I be buying for neuropathy? Well, when you go in and you take a look at when you talk to your bud tenders, pay attention that first of all that the products that you're purchasing have this particular terpene profile that we talked about before. In many cases, when you see things like, for example, you may be using a THC cream without that particular complement of terpenes, may or may not work, probably won't work because what you're looking for is that terpene profile. Pay attention to the construction or what's in the product. How do you know what's in the product? Ask for a certificate of analysis. They'll be able to identify what's in the product and what can help quite a bit. I would indicate in your case where you're looking at using indica vapes and indica capsules, you might want to go to a hybrid product because it's a little bit stronger from the standpoint of its reaction and it can help quite a bit. I don't know if you really want to use a sativa leaning product. Won't hurt to do that, but I would say go with more of the hybrid type of product. I think you'll find some better results. And again, match or see what the products that you're using, see if they have the terpene profile And you may be surprised that you may not have all the terpene profile. That might be one of the problems that are there. And or talk to your bud tender about making sure that they have for example, some nanotechnologies. Nanotechnologies mean the product is fast acting, and that could help you quite a bit. Next question is, can THC CBD lotions help? The answer is absolutely. And are oral gels better? Well, interestingly enough, oral gels do work, but the lotions work right away, as you can see from the topical and transdermal. When you get into taking an oral gel, that falls into the capsule category down here. And the capsule category could take anywhere from up to 2 hours of work. Some work in 30 minutes. I know there's a couple of firms coming out with some right now they're coming out with some TheraGels and some gels that are going to work literally within 10 minutes because of the nanotechnology. There's again new technologies coming out that will be introduced into the market over the next month or two. But what you may want to do is you may want to take a look at something, for example, like an edible. This would be a gummy. This would be a brownie. This would be a cookie that would last. When you talk about can I have something that lasts throughout the night? This will go to work usually within 20 minutes to 2 hours, again, depending on the product that you're using. I would say usually edibles work within 30 minutes to 2 hours, and then last anywhere between 4 to 10 hours. I use an edible to get my sleep. I make brownies. I have what I call my magic brownies that help me sleep at night, and it really does a good job because it carries you through the entire night. If you use a tincture or use a vape, the tinctures will stop working, for example, here in about 4 to 6 hours. Vape's even shorter amount of time. So you'll wake up at 2 and 3 in the morning with that pain. Then you got to try to do it all over again and try to fall asleep again. Or if you use an edible, for example, it should take you and should work throughout the whole night. And that's really the route you want to go is again the edible or capsule route for that particular area. The other question is what's the best route for dull or sharp nerve pain in my neck and back? No, I don't have neuropathy, but I have herniated discs in my neck. I have 7 of them, and I find that the best relief I get is from a topical. And when you say what type of topical, I have found that the creams for me work better than the balm. If I find a neuropathic cream, for whatever reason, they just work for me a lot better than the balms. Now, I know for my wife, it's exactly the opposite. She finds that the balms work better than the creams. So again, every person's body is different. You may want to experiment with them. But I find if you want instantaneous relief, topicals help quite a bit. And then don't forget the fact that if you carry a vape pen with you, I carry one with me. I have a vape pen that is a one-to-one vape pen. So if I have any problems at all, because I have bad knees, I have bad neck, bad back. So the interesting thing is, if I grab that vape pen, take a hit out of it, it works like right away, and that'll help me not only for the next 10 minutes, it'll help me for the next 3 to 4 hours. That's really out there. So you may want to take a look at carrying a vape pen. That could help quite a bit in pain that just kind of pops up during the day. And I find that's my relief that I use. I kind of have it's like a backup vape pen, and unfortunately, I have to use it. It's part of my condition, and my condition does come back on. Like last question here is, what can I take for neuropathy to my in my lower limbs? I have the pins and needles from my knees to toes. Yeah, and that's the bad thing about neuropathy. It's just really a killer. This is where I think the topicals can help quite a bit. And I would say also pay attention to the right what type of tincture that you want to use. Now, tinctures are very, very important because again, they'll work in about 15 to 20 minutes, typically last 4 to 6 hours. They take full effect usually in about 30 minutes. And what you'll find is that, especially when you're taking it for the lower limbs, what you want to do is you want to get something that gets into your bloodstream. Now, what's the best thing to take? Candidly, something that's higher in CBD. So you might want to find a CBD product that is say a 2-to-1, meaning 2 CBD to 1 THC, a 4-to-1, or potentially even as much as a 9-to-1. That'll help quite a bit because that CBD has that neuroprotective coating that can help. And by the way, cannabis is very interesting. Your body knows that you have a problem. It tells your brain. Your brain will then create the cannabinoids and send it to that part of the body that's causing the problem. So your body will know it's the lower limbs. Again, I would recommend, you say which one to take? I'd recommend a ratioed product that is higher in CBD than THC. So it's something that's more than 2-to-1, 3-to-1, 4-to-1, that type of thing. And I would try to look at things like tinctures. They have gummies now that are 2-to-1s that could help quite a bit. And they'll last a little bit longer. But again, that might take anywhere between 30 minutes and 2 hours of work. And then again, if you want instantaneous relief, again, the vape pens and the topicals are the ones that'll help you there. I hope that helps. And I wouldn't worry about any routes of administration to be avoided. I would probably if I'm using neuropathy, stay away from flour. Not that I'm against flour. I think flour is a great way to go. I just think from a neuropathic patient standpoint, it might be harder to just roll and put those things together. That's all. Next question is info on the product packaging status. It says states, let's see, info states not to use bombs over large areas, but is okay to use in both hands and both feet at the same time. I have not seen anything that says, or I've not read anything that has said it's not good to use a bomb over a large area, especially it's a CBD bomb. I know that in certain, when I was getting my degree, we did some work with some senior citizen centers, some senior citizens homes, I know in some hospitals, and they were putting, for example, they were putting bombs and things on the lower parts of the legs and the bottom parts. Now, I know that in places like Colorado, where they were doing some experimenting with CBD on neuropathic patients, they were using a CBD bomb, based bomb. It did have some THC in it, and they were using it on a larger area. So I wouldn't worry too much about the size of the area. No, I'm not sure it's being used for your whole body. That I think that makes some sense. But on the other side of the coin, if you, for example, the last patient was recommending, what do I do for the lower part of my legs? I think a good topical would work and help you quite a bit in that area. And again, I separate balms from lotions. Balms tend to be a little bit, let's just say, thicker, and they go on. They're a little, let's just say they're a little. They're not as viscous as the lotions itself. I know the lotions I tend to like to use because it gives sends it for my body. It tends to get into my bloodstream a little bit quicker. But again, I wouldn't I wouldn't rule out bombs because again, as I mentioned, my wife swears by them, and it's something that every person, it just depends on your body and your particular condition. Next question is, can cannabis help with bursitis in my left hip? And the answer is, it can help you relieve the pain. It's not going to get rid of the bursitis, but it'll help you with the pain and it'll help you with inflammation. One of my best friends has I guess he has a right hip problem, and he has bursitis in it. And we put him on a cannabis routine. Again, it's a regime that has higher in CBD than in THC. So in his particular case, he's using a 4-to-1, and he's using a topical and also a tincture to help him with this particular condition. And it has helped him quite a bit. So the answer is yes. But it targets mainly the pain, the inflammation. It won't get rid of it, but it'll sure help you manage it. And if you can take that pain level from a 0 to a 10 level, where 10 is the most painful, you can take it down to a 1 or as close to a 1 as possible. That's going to help you quite a bit manage that particular situation. Another question is, are there low THC options that can help with peripheral neuropathy? I have sensitivity to THC. And the answer is yes. In fact, candidly, I recommend in general for not just peripheral neuropathy, but most neuropathy, I recommend a high CBD product, primarily because of the neuroprotective capability of CBD. That's what you're really looking for. And when you do that, when you use a higher ratioed product, meaning a 2-to-1, 4-to-1, or whatever, that's going to give you that higher ratio of CBD to THC. That'll help you quite a bit. And so the answer is yes. Stick to your high. The answer is yes. It'll work. Stick to them. And again, it works not only for that particular condition, but most of your neuropathic conditions that are out there. Is there research on cannabis that targets peripheral arterial disease, artery disease? The symptoms are similar to neuropathy. Well, there's been research that's been done, I know, on arterial disease. I have not seen the results of it. I know that there's research that's being done in Israel on it right now, and it's something that they're taking a look at. I don't know of any studies that have been done. Let's put it this way: I know studies being conducted, but I don't know if studies have been concluded on this particular situation. However, I do know that the preliminary findings from the study that I saw from Israel basically recommended, like we're talking about right now, a higher THC product, a CBD product, higher CBD to THC product, has actually provided better relief than the opposite. So it's something that you may want to take a look at. And it is something that can help. Again, that neuroprotective capability is something that's really, really the magic of cannabis, helping to relieve the pain and help the condition of neuropathy. Next question is, what products do people use to relieve diabetic neuropathy? Nerve neuropathy. Again, it's a kind of I'm not trying to lump things together, but this particular condition really comes from the myelin sheath being basically eroded or somehow compromised. And so by being able to use a CBD product, it'll help quite a bit, both with the nerves and all, whether it's diabetic or whether whether it's peripheral or whatever that's out there. Now, I do know that this particular condition is one that, again, is very, very, very painful. And what you may want to do is you may want to use more like the tinctures for this, and you may want to use something like some of the edibles for this, especially if you're trying to sleep during the night. That might help quite a bit. And again, pay attention to the terpene profile. That's what you really want to pay attention to. So yeah, there are products that can help with diabetic neuropathy. Again, high CBD ratioed products. And again, use the type of product that you're comfortable with. Again, the route of administration is something that's very personal. Find out what you really are, or that really likes. Next question is, where would I start to treat fibromyalgia? Well, fibromyalgia is obviously different than neuropathy, but they have many of the same, how should I say, characteristics. And when we take a look at here again, here's our terpene profile. And on the left-hand side shows you the different conditions that we're trying to address. And again, the table that shows you which terpenes work. And as you can see here, again, this is the myrcene, the limonol, the myrcene, linalool, the limonene are very, very effective. Also, the pinene and the caryophyllene are something that can help quite a bit. This is the terpene profile that you're looking for, and it works for fibromyalgia as well as for neuropathy. So again, your body knows what the problem is. Your body then tries to address your particular condition. That's the benefit of the endocannabinoid system. Your body will find out what the issue is, will tell the brain that you have this particular problem. Your brain will then produce the endocannabinoids it needs, and those endocannabinoids will have these terpenes in there to help you be able to address that within your own body. So the answer is, how do you start? Start with, I'd almost start the same way as I would with neuropathy. I know it sounds crazy, but I'd use the same amount of same terpenes. And again, find a route of administration that you're comfortable with, and pay attention in this particular case, both for fibromyalgia and also for neuropathy. You have a situation where this is going to last almost all day. So get yourself into a regime or a treatment regime that not only lasts for the short term, being an hour or two, but what are you going to do this morning? What are you going to do when you get up out of bed? What are you going to do in the morning? What are you going to do right after lunch? What are you going to do after dinner? What are you going to do to sleep for the evening? I have a regime that I break my world down into four different pieces, and I have a regime for each one of those pieces based on my schedule that particular day and the amount of pain level that I may get from the activity that I'm doing, whether I'm working out heavily and, for example, I do martial arts, or whether I'm just working at the desk. They're two different. I might try two different things. One, I might use a vape pen. The other one, I might use a gummy. Just depends on what I'm doing and what I want to stay focused. But again, same terpene profile can help you with that. Next question is there research for using medical marijuana to control, and I may not get this right, but it's called I'm not going to pronounce this correctly, I know, but anyway, I'm not going to destroy it. Here's the I took a look at looking at this particular condition, and the answer is yes, cannabis can help quite a bit for this. A lot of times you have an onset that comes from inflammation that's causing this particular condition. Naturally, that inflammation causes pain. And so if you can reduce the inflammation, you can then relieve the pain. And if you can relieve the pain, that obviously helps you with that particular condition. And again, goes back to looking at the symptoms. This is a very busy slide, which may be hard for you to read, especially if you're on a cell phone or on a tablet. But it's a slide we'll include in the deck when we send it out to you. And you'll be able to take a look at the different symptoms and effects and what terpenes you use. Again, stick with the myrcenes, linalols, limonene. Pinene does a great job, and some caryophyllene can help you quite a bit in this particular situation. So what you may want to do is go back and pay attention to looking at this profile, going into your cannabis dispensary and really asking them for products that can help you with this particular condition. And I hope that addressed the issue. I hope that addressed that particular question that's there. Not simple, but it's something that can help. And again, I know I'm not going to get the name correct, but I do know that we can help with the pain. The sudden onset will come from inflammation. It'll come from some condition that you had. And again, that's where, like I say, I carry a vape pen for instant relief. I use a lot of topicals. I use, again, either capsules or edibles to help me on the long term. And so it's something that you may want to produce a regime that can help you. This is there. Next question is, can cannabis help with restless leg syndrome? Where can I find out information about it? If you want to find out about restless leg syndrome, I'd say there's two different sources. One is you want to go to a source called PubMed. PubMed is the government's the National Institute of Health's database on different conditions, and they talk about all the studies that are out there, not just for cannabis, but for all different conditions. And I know restless leg syndrome is in there. The other place you might want to take a look at if you're looking for cannabis research is that there's been research that's been done by Dr. Ethan Russo, and part of Dr. Russo's studies also addressed restless leg syndrome. Can cannabis help with that? Well, again, it's not going to get rid of it. What this is restless leg syndrome comes from a firing of the nerves that's in your legs. And it usually happens involuntarily. In other words, you're just sleeping at night, or you're sitting on a couch or something, and all of a sudden your leg all of a sudden gets very restless, starts moving, and that type of thing. This goes back to, again, you want to coat those nerves. This goes back to the myelin sheath. It goes back to having those nerves be put into a condition where they're in what they call homeostasis, which is their natural state. And that goes back to using something that addresses the inflammation as well as the pain. In many cases, people are trying to address the pain, or they're trying to look for a spastic type of relief that's there. But really, what you're looking for something is more to control the inflammation, because that inflammation is causing a lot of that restless leg syndrome. So, and consulting a couple people on this particular situation, I know when I was taking my courses, one of the things we found is that a high regimen or a high dosage of CBD to THC did help with that. But again, it's something that is going to take a day or two to really work. It's not going to work almost immediately. Like if you take it today, it's not going to necessarily help you tonight. It'll get better, but over a day or two, you'll find that condition will be relieved a little bit. It came on. It took a long time for this to come on. It's going to take a little while for it to just basically go away. And I hope that helps that particular answers that particular question that's there. Next question is, what would cannabis do with a damaged vagus nerve? I'm 79 years old, very active cyclist, injured in a bike accident. Well, I can, as a cyclist or ex-cyclist, I should say, I can relate to that. The answer is yes. It goes back to it again. It's not going to solve or cure anything. What it is going to do is this vagus nerve, again, goes back to our terpene table. We're looking at addressing pain. We're looking at addressing inflammation. And in this particular case, what we're doing is we're looking at muscle relaxant, muscle relaxants and things like that. So again, you want to pay attention to the primary terpenes that are there. In this particular case, I would pay attention to myrcene, caryophyllene, and linalool. Those three terpenes are going to help you quite a bit. And again, some of the other terpenes will contribute and help quite a bit, but those are the three that I would look for when I go visit my dispensary and talk to my medical marijuana doctor about that. And also what you're looking at is you're looking at something now that it's not just a matter of putting a topical in a particular area. You want to really simply put your body back in homeostasis. And by homeostasis, we mean in its natural state, in its relaxed and conditioned state. And that's where you're taking a look at something like a tincture that'll help you quite a bit. And candidly, also, this is where places like gummies, edibles come into play, because may take a while to work, but it'll help you calm down and help this last over 4 to 10 hours. And I hope that helps answers that particular question. Let's jump into the next question. Is there a precedent for anybody finding relief from SCI, spinal cord injury, neuropathy, is using any form of cannabis product? Where can I find out more details? Spinal cord injuries are one that are very difficult. And as you know, there's a lot of research being done right now. I saw some studies last week coming out from England on some spinal cord injuries, and also some from China that are doing some interesting work in that particular area. When it comes to cannabis related to that, what you're really looking at is the neuropathy that comes with that, again, goes back to the sheath, the condition being the sheath being damaged, the nerves being damaged. And again, going back over here, looking at our different tables, we're looking at things that not only give you the neuroprotective capability, that can give you the muscle relaxants that are there, and also can help candidly with antidepressants and stress relief, because it basically that helps to accentuate or exaggerate that particular condition itself. You're also looking for something that has a lot of the analgesic capabilities. And again, that if you look at over here from the analgesic standpoint, this is where your pinene, linalool, myrcenes, caryophyllene, and eucalyptols really come into play. So the answer is it's not going to cure it, but the answer is it can help with the pain and it will help to avoid the pain, the quick onsets of the pain, and to actually it'll reduce the inflammation, and then by reducing the inflammation, it'll help with that particular condition itself. Now, if you have a spinal cord injury, you're working with a doctor on that particular situation. Most of the cannabis products, in fact, almost all the cannabis products, will work with whatever is being prescribed for you for that particular condition. But please let your doctor know you're using cannabis. Please let him know that you're going to use a high CBD to THC ratioed product to help with this particular condition, because he'll probably welcome anything that can help with to reduce the inflammation in this particular case. It will help with your particular condition. So hopefully that'll help open up the door and help your doctor work with you on this particular condition. Let's jump into the next question. Um, what type of medical cannabis is built to help with pain in the Charcot-Marie Tooth disease? Well, again, going back and looking up this particular disease, this condition, cannabis is not going to. There's no cure for this particular condition, and in this particular case, it's not going to cure it. But what it can do is it can help you manage it. And again, going back to this table, we're looking at the same set of relief points that we are before. This is something that we're looking for pain. You're looking for something to release the inflammation. I know I keep bringing up inflammation and pain, but what I found, especially with I have artificial knees, is that when my knee swells, I get pain. When my knee doesn't swell, I get a lot less pain. I mean a lot less pain. So what we're looking at something that's an anti-inflammatory, which most of the terpenes here take advantage of in this particular case. And then also you want to take a look at something that can help be a muscle relaxant as well. That'll help you with this particular condition. So the answer is yes. There are some terpenes that can help you with that. Cannabis will help to manage this, to help you manage through it. It won't get rid of it, but it'll help you manage the particular condition. Let's jump on to the next question, if you don't mind. Question is, I live in a state with no legal cannabis, medical or otherwise. Is there an affordable hemp equivalent to high THC cannabis with terpenes? I've had 3 back surgeries and need it for pain. This is a real conundrum because hemp products, hemp THC and hemp CBD are exactly the same products that you find in marijuana. The difference is hemp products, by definition, a hemp product has 0.3% THC or less, which means that especially when you're looking at addressing pain, especially for pain for back surgeries and things like that, you're going to need a high THC product. And this is where it's kind of a hemp and high THC don't go together. Now, be very, very careful here, and let me tell you why. When I did a webinar on on Delta 8, Delta 9, Delta 10, I went to a lot of hemp shops, and I bought. In fact, I have some products that I purchased that claim to have a THCA rating or about 50% THCA, which when burned should turn into THC, which is an extremely high amount of THC. I went and took those products and had them tested, and I found out they weren't natural hemp products. They were hemp products that were sprayed with an isolate to get that level of the level concentrates up of THCA. And in fact, they weren't. It wasn't just THCA. They sprayed this product with THC, hemp THC that was out there. So it's not. Those products were really dangerous. Those products did not have anything that talked about. The mold did not talk about how they were made. Did not talk about the background chemicals that were in the product. And candidly, I stay away from using them because I just don't trust them because I don't know how safe they are. Let's put it that way. So I'm not sure there's an answer for you. Without a legal cannabis market or a medical marijuana market, by definition, high cannabis product is high THC, and so it's something that doesn't work. That's there legally. And because I'm on the air and I'm talking to you here legally, there really is not really an alternative that I know of. You can try some of these hemp THC products. You'll see tips products that'll have again, like I said, I saw a number of products and purchase products that had a higher THCA ratio, meaning that when you heat them up, they'll turn into THC, but they don't have the certificates of analysis that made me comfortable. That's something that I would use for my particular body. So I wish I could give you a good answer. There really isn't one right now. Unfortunately, that's one of the reasons why we try to legalize cannabis is be able to give people an opportunity to have have something that can help them with their condition that doesn't cause the horrible side effects that we get from a lot of the pharma drugs. So I'm sorry I don't have a better answer for you, but I just want to be straight as to what's really there. And obviously, if you get some THC products and things from outside of your state, that's your legal liability. But right now, I just don't see any legal alternatives to being able to do that. I'm sorry to answer that question that way, but I don't. I would rather give it to you straight than try to make some magic up that I don't think is going to happen. High hemp THC products are dangerous. I'll just be candid with you, they're dangerous. And they're dangerous because I just don't know what's in them. I know that the ones I got and I tested, I would not use. Okay, let's put it that way. They did not pass any of the cleanliness tests, and they did not give me all the background information. And when we did do the testing, we found that they did have some mold in the product itself. So anyway, it's something that we need to be very careful of. Wish I had a better answer for you that's there. So let's jump into some of the questions that were asked by the audience during the webinar tonight. And by the way, thank you very much for submitting the questions. One of the things we really enjoy doing is answer your questions on webinars. And I should point out in the future, we're actually looking at doing a webinar just answering questions. So if it's something that you'd like to do or have a webinar that just answers questions, please send me an email and let me know. It's at events@marijuanaaware.com. Let us know if you'd like to see a webinar just to do in a full Q&A. Next question is, how do you know that terpenes are in an edible? State-controlled products do not list terpenes on the label. Well, actually, I'm going to disagree with you, John. If it's a state-controlled, if you're in a medical marijuana state, you have to have a certificate of analysis. And that certificate of analysis has to list the terpenes, the cannabinoids, and actually the flavonoids that are in the product. So if you're going to a state that is a legal medical marijuana state, ask for a COA, and they should tell you what edibles are in the product itself. The first line of defense is grab the COA. It should tell you what products out there. If it's a medical marijuana state, it'll definitely have the terpenes that are in there. Second is ask the firm you're buying it from. Ask the dispensary. Dispensary bud tenders may not know off the top of their heads the terpenes that are in every one of their products, but they have a table. They have a way of looking it up, and they can give you that information right there. In fact, the way they look it up is they pull the COA for you right there. So I would ask the bud tender for that particular information. If they don't have the information about the terpenes in the edible, I don't know if when you say state controlled, I'm assuming it's a state medical marijuana dispensary. If it's a hemp dispensary, it may not have the terpenes on the label, and that's again something that you need to be very careful of. So there are terpenes, by the way, in edibles that are there. I know the Wana products. I know my wife uses a Wana product that's a 2-to-1. I use a product from Air that's a 1-to-1 product, and it's a product called Kind. And I know that it has a very high terpene profile that helps quite a bit, again, with your inflammation and also for your pain. So you may want to take a look at some quality dispensaries. I know Air is in 14 states. And so it's something you may want to take a look at and get some input on that particular product. Hope that answers that question, but the COA should give you the answer to that particular question. And yes, there are products out there that do that. Next question is, can you speak about THCA version of a full extract cannabis oil, and how is it made? I cannot get rid of much of my pain without being really stoned. Okay, so let's back up a little bit. Um, F Full extract cannabis oil is probably going to be what they call full spectrum oil, FSO, and that's going to be a derivative of Rick Simpson's RSO, and that is an extremely strong product. I tend to call it the Bacardi 151 of the cannabis world. Be very careful. Don't take a lot of it. A little bit goes a long way because it will get you stoned, but also it's extremely effective. Now, THCA is a acid version of THC, and it's produced right after the CBGA is molecules created that then produces THCA, CBDA, and CBCA, and those are the acidic versions. With time and with heat, they can convert it over into THC. Okay, so that's how that particular product happens. I know that when you look at full spectrum oils, they typically have THC, not just THCA. They will have some THC in there, but mainly THC in there, as well as CBD and also some CBD and CBG, plus a bevy of other cannabinoids. And being a full spectrum product, it'll have all the terpenes that are in there, which is just great. So my counsel to you is do two things. Um, I would find yourself with FSO product, full spectrum oil product, or RSO product. I'd probably go with the full spectrum product because when Rick Simpson first made the product, he used one type of cutting agent. Now they're using a different kind of cutting agent that's more, as you say, it's more healthy. Both of them are still okay, but the current ones are, just to say, better for you. And it's something that will work quite a bit. But also pay attention to the amount that you're taking. Find out from a dosing standpoint, go through the whole dosing regime, starting with a little bit, maybe just if you're using oil, for example, you use maybe a quarter of an eyedropper to a half an eyedropper, then a full eyedropper, for a day or two with one side, day or two for a little bit more, a day or two, a little bit more. Find out where you get where you get relief, where you get that therapeutic dosing level that will really help you. And then if you get past that, you begin to not feel as well, you begin to get stoned. Then you want to be able to bring that back and use that particular amount that's there. I think what's happening is you may be using too much of it because you didn't go through the dosing regime, and that's okay. That typically happens, but it's something that you can, in fact, manage it by knowing what your therapeutic dosing level is, your sensitivity to THC/THCA. That'll help you quite a bit. So the answer is, I'd like to speak to you about not just the product, but also going through a dosing process to help you find that therapeutic dosing level that can help you quite a bit. Uh, these products, these full spectrum oils and the full extract oil, cannabis oil, they will help you with your particular condition. They will address inflammation. They will address pain. But again, you got to be very, very careful to be able to manage that therapeutic dosing level and not take too much. What is the onset and the duration of suppositories? Well, again, there are three different types of suppositories that are made. The most popular ones typically work right away. In other words, they work within 1 to 10 minutes, and they typically will last anywhere between 1 to 4 hours. That's typically what you'll find with your most common suppositories. There are some that have been made for extreme cases where they'll take maybe as long as 30 minutes to work, but they could work for 6 to 10 hours. Those we really don't find too many of those, but you'll typically find an onset and a duration time very similar to what you would find with a very quality topical product that's out there, and something that's like again, like more of a, where topical products only last for 1 or 2 hours, the suppositories will last typically about 4 hours, sometimes 6 hours. I do want to caution you a little bit in that every person's body is different. So one person's reaction to medical cannabis may not match another person's reaction to medical cannabis. And I say that because it may take some people longer for the onset and the duration than others. Again, this is where you need to experiment a little bit. But most of the common suppositories out there are almost immediate onset, meaning 1 to 10 minutes, and typically anywhere between 1 to 4 hours. That really helps. I hope that answers that particular question. Um, it's Is it safe to put a transdermal patch on the spine where my injury leaves? It says pay attention to the placement warnings on the packaging of all topical products. I use a transdermal patch. I swear by them. I just love them. And I use a one-to-one, by the way, just because that really helps me with my particular case. And because I have my particular injury is right in my back, right, in my neck, right just below, just below right on my neck itself, right on the spinal cord. I put it right in there. I put it just below where, so if I have a shirt on, you can't see it, just below there. And I put it on and it looks great. I haven't had any problems with it. But again, every person's body is different, but you might want to try it. The nice thing about transdermal patches or any patch is if you put it on, and it usually start working right away. It usually work within 1 to 10 minutes. If after about 10 minutes, 20 minutes, you're not feeling good, you can take it off. And what'll happen is, and again, that 1 to 10 minutes that you had it on, within that amount of time, it'll dissipate out of your system, and whatever symptoms that are bothering you will go away. That's the nice part about patches, which no other product really has. Once you take a transdermal patch and use it, you can take it on, you can turn it off. When you use tinctures, vapes, smoking, once you take it, you're kind of stuck with it in that particular case. That's why I like patches. They really get you to be able to find out what's there. But I wouldn't worry about putting it right where the injury is. In fact, what I would say is the closer you can put it to the injury, the better it's going to be. That's what I have really found. I did have some situations where I injured my knee, and I put a transdermal patch on it, and it helps quite a bit. So I didn't worry much about it. I haven't worried so much about the placement of it. I just want to make sure it was in the vicinity of the particular condition to be able to get the best effects for my particular condition. And I hope that answers that question, John. And good luck with it, by the way. I love transdermal patches. Give it a try and let me know how it works. Go to the next set of questions. Next question is, what would you recommend to lessen the severe, sudden facial electrical jolts into, again, I'm going to go back to that word that I have trouble pronouncing. I would say the best thing to do is um, what's causing these is believe it or not, it's an inflammation issue that comes into play. And it also is an issue that comes in the fact that the nerve has been basically damaged, where the myelin sheath is either damaged or not even there sometimes. So what you might want to do is you might want to take a look at using, in this particular case, for sudden pain, pay attention to using something like to address the pain itself. I would use a vape pen. I found my vape pens help quite a bit. When I hit my vape pen, literally within a minute or two, it starts addressing that particular pain that's there. The second thing that could help quite a bit with this is to try to avoid it. So try to get ahead of the situation is to use a high CBD to THC ratio tincture product. Get that CBD in your body. The CBD in your body will do the coating of the nerves themselves, and that coating of the nerves is what will help to relieve or to cut down on that what they call the electrical jolts that are really there. And these are painful. I really know that they're there. I work with patients that have had some real serious issues in this area, and again, we find that the CBD has helped quite a bit. And if you can find a vape pen, you can find a tincture, and you can find a gummy that can help in those areas. That'll help quite a bit. So I hope that helps. The best thing I would use if I have sudden pain like that is I would use a vape pen. That would help me quite a bit. And by the way, you can find the terpene profiles in the vape pens when you talk to your dispensary. They'll help you quite a bit with that. The next question, Susie has an interesting question. It says, my neuropathy shows up in a weird sensation in my feet while walking after affecting my balance and stability. Since pain isn't a big problem, are there any other specific terpenes to try? The answer is no, this should help. If you are using the right terpene profile, this will help again. What's the cause? The cause is the myelin sheath that's being damaged or isn't there. And what you want to be able to do is you want to get that neuroprotective capability to help quite a bit. That's really there. Now, when you're walking, or example, you say with your feet, what you're doing is you're aggravating that particular situation. I would take a look at using something that's a higher THC product. So if you're using like a 2 to 1, like a 2 THC to 1 CBD, one product, 2 CBD to 1 THC product, back off, go and use a 4 to 1, 4 CBD to 1. Maybe even try a 9 to 1 and see if that can help quite a bit. The more you can do to help to be able to get that CBD in your body and coat the nerves, the better it's going to be. And I hope that helps quite a bit. I know that it's something that as we get older, stability and balance is really, really important. And it's a matter of just really paying attention to giving your body the resources it needs to be able to manage itself. And again, that's stick to a high CBD ratio. Next question is, where do you typically buy patches? Well, first of all, I patches are available at almost any dispensary. I find most, I'd say about 70% of the dispensaries that I work with carry patches themselves. The THC patches that have, or the transdermal patches that last up to 72 hours, I buy them from a dispensary called Move or Verano. I know here in Florida they're called Move. Outside of Florida they're called Verano, and they have some great, probably some of the best patches in the market that's really out there. And that's probably where I buy them. I know I get my patches from a number of different spots. And again, Cetera has a great product patch capability. True Leaf has a great product. I know, but Move is really the I call the premier spot for patches. Then you want to take a look at that, and I hope that helps answer that particular question. Patches aren't necessarily something are commonly found when you buy online products in general, because a lot of hemp products don't make patches. But I do know a lot of the medical marijuana dispensaries do find the patches are very helpful, especially for people that have conditions like neuropathy, conditions like fibromyalgia, conditions like arthritis. It can help quite a bit. That's really in that particular area. So I hope that answers that question, John. And hopefully, again, you can find a Move dispensary close to you that can help with that particular question. Do we have any other questions that come up? So we seem to have answered all the questions that are out there. And so first of all, what I want to do is I want to thank everybody for attending this particular webinar. I know it's been one that we kind of put the information right, straight up front, right to the point, because we know especially if you're looking at neuropathy, you just want to know the answers. What do I take? What can I take? How can I take it? Where can I get the relief? Because it's a situation that you really want to be able to address right away. And I want to thank you very much for watching this webinar and hanging out and going through there. If you want to find out more information about medical cannabis, please check out our YouTube channel, Marijuana Aware. We not only will have this video up by the end of this week, but we also have other videos that could help you. If you're looking for a card, medical marijuana card, I recommend Medical Marijuana Treatment Clinics of Florida. That's mftcfl.com. That's their website. They can help you. They have 22 locations here in Florida. And not only do they help you get a card, but they'll also walk you through not only getting the card, what's your journey look like? What does it look like together? What should you be taking when? The first 6 months, we walk you right through that. And also they have a call center you can call that can really help answer your questions. And this is important. They just don't leave you hanging. A lot of doctors, when you get a card, just give you the card and then you're on your own. This is a group that really walks you through the whole process and really pays attention to helping you get your life back. And naturally, if you're looking for a great set of medical marijuana products, I recommend Air Dispensaries. They have a very broad range of products. They have a great quality control program, and they do a great job of training their personnel, including their bud tenders, to help you. That's really out there. And last but not least, I want to thank a couple of people in the background who've been helping me do this webinar, Lee and Leah. Without it, it wouldn't happen. And it does look smooth on the screen, but a lot of work is being done in the background. I want to thank them for doing that and for helping it put this all together. I hope you join us. Our next webinar is going to be March 18th. We're going to talk about weight loss. And then I do want to tell you that we are going to come up with a whole new set of webinars for the next quarter for Q2. We'll be announcing them within the next 3 to 4 weeks. And please pay attention to doing that. And in the meantime, if you have any questions at all about medical cannabis, please check out our